Bismillahirrahmanirrahim. Today our topic is Augmentin tablets. Qualitative and quantitative composition of Augmentin tablet is there. Augmentin tablets contain amoxicillin and clavulanic acid. Augmentin tablet of 375 milligram strength contain 250 milligram of amoxicillin and 125 milligram of clavulanic acid, and the Augmentin tablet of 625 milligram contain 500 milligram of amoxicillin and 125 milligram of clavulanic acid, and 1 gram tablet contain 875 milligram of amoxicillin and 125 milligram of clavulanic acid. And the suspensions of 156.25 milligram each 5 ml contain 125 milligram of amoxicillin and 31.520 milligram of clavulanic acid, whether the 12.50 milligram of suspension each 5 ml contain 250 milligram of amoxicillin and 62.50 milligram of clavulanic acid. The mechanism of action of the Augmentin tablet is penicillin binding proteins and inhibit the cell wall synthesis of the bacteria. Where the indication and usage of the Augmentin tablet is used for the upper respiratory tract infections including tonsillitis, sinusitis, and it is used for the lower respiratory tract infections, bronchitis, and bronchopneumonia. Genitourinary tract infection is cystitis and urethritis and pyelonephritis, and it is used as a skin and soft tissue infections, cellulitis, bone and joints infections, and also used in dental infections and other infections in intra-abdominal sepsis, etc. Dosage of the Augmentin tablet, adult and children over 12 years, 375 milligram tablets 3 times a day, and 1 gram tablets twice a day, and 625 milligram used for 3 times a day. And the suspension is 5 ml Augmentin 156.25 milligram 3 times a day, and 5 ml Augmentin 312.50 milligram suspension 3 times a day. Where contraindication of this tablet is hypersensitivity of this composition. Patient should not take the tablets, and side and adverse effect of this tablet is common side effect are mucocutaneous candidiasis, and very rare side effect is edema, anaphylaxis, and serum sickness like syndromes, and uncommon are the dizziness and headache.